Thanks for that introduction, and thanks to everyone for listening in today. The topic of today's webinar is the Healthcare Compliance Toolkit, Best Practices for Compensating and Contracting with Physicians. And since you're tuning in, I'm assuming that those of you listening into the webinar are working within a hospital or health system with respect to physician contracting, either in a management role or perhaps a leadership role within the physician group or a physician leadership, or perhaps you're a physician or a member of a medical group or individual physician practice. And I think in all cases, the content of today's webinar hopefully will be very useful to you in any of those positions, because we're going to be hitting on some of the main topics that are impacting healthcare organizations across the country. Are going to try to give you some takeaways or tools or concepts to use in your contracting and compensation processes with respect to physician transactions and physician arrangements. In my practice, I work with healthcare organizations all across the country on physician compensation and contracting issues. We're seeing a lot more focus within healthcare organizations in putting more resources behind compliance in this area, starting to develop processes around physician contracting, and maybe more than anything, the development of some best practices nationally on how to contract with physicians and how to develop compensation arrangements in a way that enhances compliance and then helps to manage risk. And as many of you know, there have been a number of recent START cases where physician compensation and physician contracts have been the focus of those enforcement actions. They've brought some very large damage figures, and that's why it's really important that you get the arrangements right. And I'm hoping to share some of my experiences and our experience in working with healthcare organizations, and I'm hoping you leave the session with your questions answered and some new perspectives on Stark Law issues and physician arrangements. If you don't get your questions answered, please circle back with me. I'd be thrilled to talk to you about any issues you may be dealing with, just to give you a general reaction to how you're handling your contracting now or your compensation now. Be more than happy to talk with you. My contact information is right there on the first slide. Feel free to email me or give me a call. Again, my name is Joe Wolf, and I'm an attorney with Hall Render. Please check out our website at www.hallrender.com. If you do, you'll see that we are the largest healthcare-focused law firm in the country, and our national client base of healthcare organizations gives us a unique take on your business and compliance needs. Our model is to pull together a team of experts on healthcare legal issues, and that's what we have built. We have attorneys across our firm that focus on HIPAA, that focus on reimbursement issues and on new advanced alternative payment models. Me and my practice, I focus solely on physician compensation, Stark, healthcare valuation issues, and medical group strategy. Really enjoy working with my clients in not only developing individual compensation arrangements, but broader approaches to aligning their physician strategy with their overall system strategy. As I mentioned, we have in our firm people, attorneys that really are focused on all different areas. So if you ever have a question, feel free to reach out to me. If I don't have the answer, I'm sure I can find someone on our team who does. So I'm thrilled to have everyone here today and to step through this content. Here's our agenda for today's webinar. We're going to start off with some introductory concepts. Going to talk a little bit about the road to compliance and the enforcement environment. Like I said before, there have been a number of Stark Law regulatory